The COVID-19 pandemic has caused the biggest fall in life expectancy since the Second World War. A study by Oxford University has analysed the data from 29 developed countries, including most of Europe and the United States. All but 2 of them experienced reductions in life expectancy. Now, overall, men were harder hit than women, with American men taking the hardest hit. Life expectancy for this group dropped by 2 years from 2019. Authors of the study are appealing to more countries to make mortality data available. That's to better understand the impacts of the pandemic globally. Or for more, Dr. Ilya Kashnitsky joins us live now from the University of Southern Denmark. He's one of the co-authors of this paper. Dr. Kashnitsky, this is the first major study to show impact of the pandemic on mortality. Can you tell us more?
Hello. Yeah, sure. My pleasure to tell you a bit more. I think I need to say that this is not the first study that aims to quantify the effect of COVID-19 pandemic around the world. Even early in 2020, the first dashboards appeared that tracked excess mortality, and the idea of excess mortality tracking became adopted widely. I would say that our study is the first one to compare the effect of pandemic across the countries using the most correct comparable metric, life expectancy at birth. And we used highly reliable data for the countries for which it was available. And in this respect, this is the first study of the kind.
So help us understand then, why are we seeing greater drops for men than women in most countries?
Now, this is a very, very good question. So I think it falls into 2 parts. The first one is not exactly known why men suffer COVID worse than women, and this is what we see from all the infection fatality ratio studies across the world. So pretty much everywhere we see that men survive COVID worse than women. But the second part, in part, this gap, I think, can be attributed to behavioral factors and exposure to being infected. And in this respect, men are in worse position than women, having more exposed jobs mostly. And usually, men are just worse at adopting safe and healthy behavioral practices.
Dr. Kashnitsky, your findings show that the fall is unprecedented in the United States. So how impactful is the wealth of a nation, given that Americans were also so hard hit here?
Yeah, that's a difficult one. We see generally, I think we see very little correlation between COVID response and the wealth of a country. Well, to some extent, yeah. Even given this, the US is probably a big outlier. So we see huge heterogeneity, differences across the states of the US. US is very unequal. And there are states that dealt with COVID, quite good, maybe not worse than many European countries. There are states that are terribly worse than even the worst hit Eastern European countries. So probably a simple answer would be that America is big and diverse, and there are different stories in different states. But it's very interesting that wealth, I think, is not the best predictor of how a society can cope with a pandemic like COVID. Early on in the pandemic, there was a very interesting study that showed that the level of trust in the government is the one single great predictor of the severity of the pandemic in the country. So it really matters how much people trust their government and how much they can follow the guidance provided by the officials.
All right, well, thank you so much for speaking with us and sharing your thoughts with us today, Dr. Ilya Kashnitsky from the University of Southern Denmark.